We'll get going today. Thank you again for everyone joining us. My name is Lauren, and I am representing the NDSU Department of Public Health Seminar series today. I have the honor of introducing Amelia Nichols and Maeve Williams, who will be presenting the Center for Immunization Research and Education project updates and impact. In this session, we will hear from both of these ladies who will be really discussing some of the work we do here at the Center for Immunization Research and Education. So I also want to let everyone know that this session will be recorded and will be available on the NDSU College of Health and Human Science YouTube page following the event. If you registered today, I will be sending that link out once it's available. Our first speaker today is Amelia Nichols. Amelia is the Immunization Research Project Manager at the Center within the Department of Public Health. She started working within the department in the summer of 2021. Amelia completed her master's in public health from NDSU in May of 2021. Her specialization was epidemiology and management of infectious disease. Prior to graduate school, Amelia received her Bachelor's of Science degree in microbiology and equine science from NDSU in 2018. Aside from academics, Amelia was very active in her sorority and competed with NDSU's equestrian team, eventually earning her way to compete in the National Championship Horse Show. Today, Amelia will be presenting respiratory vaccinations in North Dakota. So Amelia, I'm going to turn it over to you.
Perfect, thank you. So as Lauren said, my name is Amelia Nichols. I work within the Center for Immunization Research and Education here at NDSU. And today, my topic I'll be presenting on is pediatric influenza vaccination rates prior to and during COVID-19 pandemic years. So we're going to look at some rates, some trends, and then also observed disparities and successes. To start with, I have no financial relationships to disclose. This is also our funding statement from the CDC and the North Dakota Department of Health and Human Services. It's worth noting as well, any views expressed are my own and don't necessarily reflect the North Dakota Department of Health and Human Services. So to start with, some of you are probably familiar with North Dakota, but in the case that some are not, North Dakota is a very rural state in the Midwest. We have a population of just under 780,000 according to the 2020 census. Our largest minority group are Native Americans, which make up approximately 5.3% based on that 2020 census estimates. And we share geography with 5 federally recognized tribes. And then also within the state, about 52% of children are eligible for the VFC program. And that, if you are unfamiliar with it, provides no-cost vaccines to children that are Medicaid eligible, uninsured, underinsured, or of Native American or Alaska Native race. So in the population of interest here, about 6 months to less than 7 years, we noticed that pediatric influenza vaccination rates were increasing leading up to the 2019-2020 influenza season, but have since been declining. So to start with, we're kind of tasked with this project from the North Dakota Department of Health and Human Services, and this is the data that kind of informed that. This comes from the Department of Health and Human Services. So it shows these 2 age groups, which are younger children, and we're really interested in this large decline following the 2019 to 2020 influenza season. So this is what started this project and kind of informed us as to why or what to do to look into this. So the main objectives for this project was to look at pediatric influenza immunization rates, identify any disparities that exist, and then provide some recommendations to improve pediatric immunization rates. So in order to do this, we had an IRB protocol that was reviewed and approved by the NDSU IRB. We requested data from the North Dakota Immunization Information System. And then we use SAS to analyze pediatric influenza vaccination rates by age group. So we limited our ages to 6 months to less than 7 years, and further broke it down to 6 months to less than 2 years, 2 years to less than 4 years, and 4 years to less than 7 years. We looked at different influenza seasons, starting with the 2016 to 2017 influenza season. And we did get data for the most recent 2022 to 2023 influenza season. We looked at race and ethnicity and healthcare provider status of where the vaccinations were administered, geographic disparities. So we looked at county level rates, we looked at regional rates, and then we also looked at East-West in addition to the overall state. We also looked at urbanicity, so whether someone was metropolitan or non-metropolitan statistical area. That also, since we have a lot of areas that are non-metropolitan statistical area, which I'll get into a little bit later, we broke that down further into rural, micropolitan, and metropolitan. So to start with, this is the overall trends for pediatric influenza vaccination rates for children falling in that 6 months to less than 7-year age range. So when breaking, let's see here. So we see the peak in the 2019 to 2020 influenza season, and then we see kind of some subsequent declines leading to a 28% relative decline from the 2019 to 2020 season to the 21-22 season. And then we also break it down by those 3 age groups I mentioned that we looked at. So the largest relative declines are observed in the middle age group, so that 2 years to less than 4 years, or the red line here. And then we also see a pretty large relative decline in the 4 to less than 7 years. So all 3 groups declined at the state level, but we experienced in the middle age group a 29.4% relative decline, and in the oldest age group a 30.8% relative decline from that peak during the 2019 to 2020 influenza season. Looking at some heat maps for the county level data. So this is the 2016 to 2017 influenza season where we started our analysis. So there's a lot of variation throughout the state. If we move to the influenza season where we peaked, which is the 2019 to 2020 influenza season, we see much higher rates compared to that. And then if we look at the most recent influenza season, the 21 to 22, or excuse me, 22 to 23 influenza season, it's quite a bit lighter. So we see a lot of variation, and in some of those, our higher rates tend to congregate in the eastern part of the state, and a lot of counties that have the higher rates tend to be rural. It's not necessarily a statewide trend, but it is worth noting that a lot of times those higher rates are observed in more rural counties. Evaluating by race, we look at white, American Indian, Asian, and African, as was identified in NDIS, where we got our data from. So just to note right away, a limitation of analysis by race is that only one race is recorded in NDIS. So there is, so if anyone has multiple races, that is not captured as we would like. But nonetheless, we've got our analysis here. So looking at our American Indian children, they had a fairly large increase. They actually had the largest increase of any racial group to the peak of the 2019 to 2020 influenza season, with a 23.8% relative increase in their rates. And then we did see a 28.4% relative decline to the 2021 to 2022 season. But what is really encouraging is American Indian children experienced an increase in pediatric influenza vaccination rates, while all the other groups continued to decline following the 2021 to 2022 season. When we look at white race, they actually experienced the largest relative decline from their peak in 2019 to 2020. So that looks at race, but if we want to explore the American Indian rates a little further, this is broken down by tribal nation. So this was the way that we coded for this is a child of Native American race, also with zip codes on or near the respective tribal nations. So they have been de-identified here just for our analysis. So there's a lot of variability among the tribal nations. We notice tribal nation B, which is in red here, has the highest rates, which is actually higher than the North Dakota state rate as well. So it'd be definitely worth exploring a little more to see all of their successes and any methods or best practices that are working well for them that may translate to other tribal nations and then other healthcare facilities as well as possible. Our green line here, which represents tribal nation C, has the lowest rates and experienced a pretty large decline. They had the largest relative decline of 54% from the 2019-20 season to the 21-22 season. So this is also worth exploring to see why rates may be low exist, if there's any data reporting miscommunications and whatnot. So that might be something that is worth looking at as well. Similar to our previous slide, the Native American children experienced increasing rates. So 3 of our 4 tribal nations reflected increases in their influenza vaccination rates from the 21-22 to the most recent 22-23 season. So that is definitely encouraging as well. There we go. Okay, and then when we look at the East versus West, we see a little bit of differences. The East peaked a year later than what we would traditionally see. So they experienced their peak in pediatric influenza vaccination rates in 2020 to 2021, whereas the West and kind of the overall state did in 2019 to 2020. And there's a little bit of reason for that. So of the 53 counties in the state, only 5 peaked in the 2020 to 21 season. And all 5 of them are in the East, and one of them is Cass County. So if you're familiar with Cass County, that contains Fargo, where I am, and that also contains about 24% of the state's population. And that along with Richland County has one of the top 10 most populated cities in addition to Fargo, since they also have Wahpeton. So both saw declines. We saw a 19.5% relative decline in the East from their peak at 52.4%. And then in the West, they peaked at 43% and experienced a subsequent 40.2% relative decline. So there's been kind of a growing disparity when in the East versus the West. So looking a little bit further based on urbanicity, this was determined based on the Office of Management and Budget at the national level. They designate which counties are considered MSA or Metropolitan Statistical Area or non-MSA, which is non-metropolitan statistical area. Of non-MSA counties, that also can be further broken down into micropolitan and rural. So since North Dakota is quite a rural state, we decided to break down the non-MSA counties to micropolitan and rural as well. So we have 5 metropolitan counties, 5 micropolitan counties, and 43 rural counties. So our metropolitan counties, similar to our previous slide where the East peaked in the 2020 to 21 season, our metropolitan counties peaked then as well, and they also experienced the highest rates, followed by rural counties, and then our micropolitan areas experience the lowest rates. So we've seen some pretty large declines in all, specifically more so in the metropolitan or micropolitan areas. So there seems to be kind of a growing disparity similar to the East and West between the metropolitan and then the micropolitan and rural areas. And both rural and micropolitan areas experience the largest relative declines. So rural declined about 37.2%, where micropolitan areas had a relative decline of 37.7%. And then also looking at where pediatric influenza vaccine doses are administered based on the metropolitan, micropolitan, and rural areas. This looks at the average of all of the doses that were administered from 2016 to 2022, and then what type or what healthcare provider type administered those vaccine doses. So in metropolitan, far and away the most often location that these vaccines are administered are in pediatric offices, the blue, and then family medicine or other private practice. When we go to the micropolitan area, it expands further to include local public health at about 16.9%, but they still primarily see family medicine and private practice as well as pediatric offices. And then when we get to the rural areas, they have a lot more diversity in their healthcare provider types, which administer those pediatric influenza vaccinations. In rural areas, local public health provides the majority of doses at almost a third of total influenza vaccine doses administered to children in rural areas, followed by family medicine, private practice, pediatric offices, but then they also include rural health and health services. So it's also worth noting that IHS and rural health clinics are only in rural areas, which is something I was not familiar with, so I learned that. But this also would inform well any interventions or recommendations for improvement and how to outreach more areas with lower rates. So some kind of final thoughts about our analysis is we saw some declines following the pediatric influenza season, or we observed declines in pediatric influenza vaccination rates after the 2019 to 2020 season on a statewide level. We noticed some disparities in children of Black and Native American race, children residing in the western region of the state, and then also disparities were observed in children residing in rural and micropolitan areas. But there were some successes in pediatric influenza vaccination rates in the tribal nations and in a few rural counties, which would be worth exploring a little bit more. So while this provides a lot of information, we do have some next steps to hopefully get a more picture of what is going on. So this is the numbers story, and we'd like to get the rest of the story, which would include interviews, focus groups, community outreach to try and understand the successes in areas with really high pediatric influenza vaccination rates relative to other areas in the state, but then also look at places in disparate areas and look at the barriers that may exist and what can be done to support them to improve pediatric influenza vaccination rates in the state. So I wouldn't be able to do all of this without all of the wonderful people helping out in CIRE, so our Center for Immunization Research and Education, as well as the people that we work with at the North Dakota Department of Health and Human Services. So a huge thank you to them for all of their support and expertise. That is what I have for pediatric influenza vaccinations. So I'd be happy to answer any questions if you have them at the end, but I will probably turn it back over to Lauren for Maeve's presentation.
Thanks, Amelia. That was a fantastic presentation, and I know we'll probably have a number of questions at the end. So now we're going to switch gears and move over to Maeve. So Maeve is the peer-to-peer project manager for our center. In this role, Maeve works to coordinate clinic-to-clinic vaccine education for medical providers throughout the state of North Dakota. She also provides vaccine education to local public health units throughout the state. The goal of this project is to keep vaccine providers up to date with vaccination information and important topics to support their confidence in communicating with patients. Maeve spent most of her childhood growing up in Omaha, Nebraska, but moved to Fargo in 2018 to pursue her undergraduate education. She graduated from NDSU in May of 2021 with a Bachelor of Science in Emergency Management with minors in both public health and history. Maeve began her work in public health during an internship with Fargo Cath Public Health beginning in March of 2020 with the response to the COVID-19 pandemic. She continued working for the agency in various roles where she developed a particular interest in health communication and education. She is currently pursuing her master's degree in public health from NDSU. Today, Maeve will be presenting peer-to-peer COVID-19 vaccine education project, an evaluation of an intervention to improve patient-provider interactions during COVID-19 and beyond. So Maeve, I will turn it over to you.
Awesome. Thank you so much, Lauren. I want to make sure I know how to share my screen here. Awesome. So I guess you am I doing good there? Can I get thumbs up? Perfect.
Looks
Okay.
good.
Thank you. Yeah, so as Lauren said, my name is Maeve. I work here at CIRE, and for the past year now, I've been working on the peer-to-peer COVID-19 vaccine education project. So I guess we'll just jump right in here. But to give a little overview of this project, it's grant funded through the North Dakota Department of Health and Human Services, also through the CDC. It started back in July of 2021, and so far it's been extended through June of 2025. So I just jumped on the project in December of last year, so I just have about a year in here, but it has been going on for an extended period of time. So we have 18 physician vaccine champions or VaxChamps across our state that are trained by our center and Dr. Paul Carson, our medical director here. So these physician vaccine champions are trained in different content about vaccines, and then my role here is to coordinate and connect them with different healthcare facilities and local public health units throughout the state. And there they give a 1-hour education in a lunch and learn format on these different topics. So our goal is to do 100 site visits per year on all of these different topics, and we'll go over those a little bit later. But to kind of promote engagement and attendance, we do offer free lunch and continuing education credit for all of our attendees. So if we look at the presentations that we're offering, we currently are up to 4 presentations that we have. Our first one, COVID-19 update, where are we at, variants, vaccines, and long COVID. Our second one, which has just been around for about a year now, no thanks doc, tools to improve difficult conversations in a medical encounter. We have a new safety talk, which was actually just developed late summer, early fall of this year. Vaccines under the microscope, how can we know they are safe? And then our new presentation, which we actually haven't been able to get out in the community yet, but we are finally just getting approval for the continuing education credits. But that one's titled Pediatric Respiratory Virus Update, COVID-19, RSV, and Flu. So if we take a look at all of these kind of individually, our first one, which we've had for a number of years now, been offering to different clinics. The goal of this presentation is really to review the current epidemiology of COVID-19 and then the vaccine effectiveness over time and with the development of the new variants. So we look at, the incidence of long COVID, what it looks like in clinics, and then how to prevent and manage it. So some discussions about the vaccines as well as Paxlovid and other methods. And then at the end, there is a little introduction to some strategies to improve communication with our vaccine hesitant patients. And that's kind of a little introduction to this next presentation we have, which is more about communication strategies. So this talk here is kind of an introduction to motivational interviewing, if any of you are familiar with that, but really just kind of talking about why people are hesitant and how our communication as providers or healthcare professionals or public health workers can really influence how people perceive vaccines and other, I guess, medical practices. So we go over the writing reflex, how doctors might use that and how it causes a patient to react, and then different strategies for addressing this ambivalence or hesitancy, and ways that we can maybe do a little bit better in the future. Our next talk, again, just developed this late summer, early fall. We haven't actually been able to provide it in any clinics yet, but we are hoping to do so very, very soon. But this is our safety talk. So providing a really fundamental understanding of how safety is prioritized as vaccines are developed in the United States and approved. So we look at the different vaccine safety surveillance systems we have in the United States and how they work together to identify the safety signals. Also kind of go over a historical example of how vaccine surveillance systems have identified safety concerns, and then how that's looked kind of in action, what actions were taken because of that. And finally, we've just developed a new pediatric respiratory virus update talk. So with the new RSV vaccine for children, we've kind of heard from different providers that, there's a lot of respiratory viruses out there now. And so we decided to put something together to kind of give an overview of the recommendations, what the epidemiology is looking like, and what providers should know. So we have, just kind of starting off with an overview of the epidemiology and the severity of COVID-19 in children, moving on to the morbidity and mortality of RSV and influenza, and then outlining the different prevention and treatment measures for all of these viruses, as well as the recommended vaccine and medication schedules. So here is an overview of our team of VaxChamps with our fearless leaders up top, Dr. Paul Carson and Dr. Tracy Newman. So they are the ones who are developing all of this content, along with the help of the rest of our CIRE team and our partners at the North Dakota Department of Health and Human Services. And then listed below are all of our wonderful providers who are trained by these individuals, and then they are the ones going out into these clinics providing the content to these facilities. So as you can see, they have a range of different specializations. They're located throughout the state, and they are really dedicated to improving the vaccinations in North Dakota. So a big question, sometimes we hear, is like, why peer-to-peer education? Why are you going out there? Why not do virtual? Why not do something else? Well, CIRE, before I was part of the team, CIRE conducted a very similar project with the HPV vaccine. So having a team of these VaxChamps go out to these clinics again, and just increasing provider awareness, understanding, and knowledge and confidence related to HPV, its related cancers, and the vaccine. And they found with this project from 2016 to 2019 that the peer-to-peer training, or the clinician to clinician, so doctor to doctor, that was significantly more successful than the current approach that was being used in order to, reach providers and the clinic staff and to have engagement and interest in these presentations. They also found that providing the free CME and food was also very influential in getting attendance. And in the end, about over 25,000 total adolescents that were vaccinated for HPV were attributed to the clinics that had these education. So this is just a picture. This is a picture from our current project, but this is Dr. Carson at Family Healthcare in Fargo. So just kind of a look at what that education might look like. So for outreach, that's kind of my side of the project. We've reached out to over 200 clinics since July of 2021 when the project began. It's kind of difficult because we reach out to the same clinics multiple times to, offer the different versions of education, but we do try and reach all of them. We look at different clinics, hospitals, and public health units throughout the state. We generally get into our the family medicine and the local public health units. Those are kind of our primary audiences that we do reach, but with the development of some of our new talks, we're also developing a OB-centered talk about the new RSV vaccine and immunization for the OB providers. So with kind of those newer topics, we are hoping to get into some of those different specialty clinics. And how we find these clinics, we have a list of the different vaccine for children and vaccine for adult vaccine enrolled providers, which is provided to us by the State Department of Health. So we look at those lists, we try and reach out to those individuals. We also have a list of the rural clinics in the state. So we do try to get out to even the most remote areas. And then just, personal connections and referrals. A lot of times people will attend the training and they'll say, oh, I have a nurse friend over at this clinic. I think they'd really be interested. So we do rely on a lot of those recommendations and connections as well. So again, here are just some images of what this education looks like in practice. We go areas big and small. So you can see the bottom left picture here is at All True Family Medicine Residency up in Grand Forks. That's probably one of the biggest areas that we've presented to. Just a nice big area with the 2 large screens. But we also go to smaller clinics. So the top middle and bottom middle, actually. Both of those are just some smaller Essentia and Sanford clinics. So kind of makeshift offices or break rooms. We bring our own projector. So we really try and make whatever space we have work to get the education out there. And then over on the right, those are some of our local public health units that we've been to. So looking at some of the outcomes for coverage, since we began the project in July of 2021, we've had 6 different presentations developed. One of those is currently being developed. It's our OB-centered talk. Been to 136 different facilities with 115 different presentations. So some of those presentations are a couple different groups or facilities will attend at the same place. So we'll just do one presentation for multiple groups. And then over 1,600 individuals we've reached. While our target audience generally are providers, so doctors, nurse practitioners, physician assistants, we actually get mostly nurses that will attend our presentations, which is awesome because nurses have a lot of patient contact as well. And they're very receptive to all of the information. So about 415 providers and 750 nurses. And then just estimating about 680 at least continuing education credits awarded since July. So this image over here shows just kind of the different clinics that we've been to throughout the state. The blue is going to be the first presentation that was developed. It was called Raise the Rate. The red is the COVID-19 update about long COVID and the vaccines and variants. And then the yellow is the No Thanks Doc communication strategies presentation. So we are trying to get everywhere, but that's kind of a little snapshot of where we are right now. So looking at who actually attends these presentations, again, like I said before, mostly we are getting our nurses. So about 45% are RNs or LPNs, and then 14% and 11% respectively are the doctors and then the advanced practice providers, so PAs and NPs. We do get a lot of other people, we get admin staff, students, occupational therapists, CNAs, we get everybody. We've had janitors come to our presentations, we really are just reaching everyone, although we are primarily targeting our providers and other clinic staff. If we look at the overall reaction, so this is kind of looking at an analysis of the evaluations for continuing education credit. We do see that actually our providers had a slightly better reaction to the long COVID presentation than the nurses or other groups of groups of workers. And our nurses had a slightly better reaction to the communication strategies presentation than our other groups. Just to notice that they are all above 4, they're all very close to 5, so they all did have very good reactions, but just a slight difference in those. And then this is self-reported knowledge of the presentation topic. So either the long COVID, the COVID-19 update, or the no thanks doc communication strategies presentation. Both of them did have a significant increase in their self-reported knowledge before and after the presentations. And I guess I forgot to mention the slide before this and this one. These are just evaluations from July of this year until December. We ended up changing the evaluation format a little bit, and so it wasn't necessarily conducive to using the old information for comparing them both together. So based on just the information from July until December of this year, 98% of respondents reported that their overall reaction to the long COVID presentation was very good or excellent, and 99% reported that a very good or excellent overall reaction to the communication strategies presentation. We noted that the self-reported knowledge increased for both presentations that we've been able to get into the clinics for. And then 96% of respondents reported either they would incorporate the information presented into their practice and or they already do so. And then just the remaining 4%, they either said that it wasn't relevant. So some of those people that maybe like janitor staff or admin staff, it's just not relevant to their work, or they had just selected others. So kind of some other reasons that maybe they wouldn't incorporate that into their practice. Nobody said no, that they wouldn't incorporate it into their practice. So if you are interested in reaching out, this is kind of all of our contact information. Feel free to reach out to me, shoot me an email, call or text me if you know of a facility in North Dakota that would benefit, or if you'd like me to come out and maybe bring the education to your facility. We're always looking for more places and more partners to connect with. So I want to thank you guys for having me, and I guess I'll pass it back over to Lauren.
Awesome. Fantastic presentation, Maeve. And both you and Amelia are really representing some of the awesome work that we're doing here at our center. So I guess I'd like to open it up to any questions that the group may have for both Maeve and Amelia. Hi, Danny.
Hi. I apologize if I had to run off and do something really quick. So I apologize if you already mentioned this, Maeve. First of all, great job, Amelia and Maeve. I'm really excited about the work that CIRE continues to do. I wonder, for Maeve, I'm curious if you could either expand on or let us know how you determine like which clinic gets which presentation. Like, do you kind of look at their rates and see what they need, or is it like a discussion with their providers and coordinator about like what sort of knowledge gaps they think there are?
Yeah, thank you. So really we just offer all presentations to all the clinics we reach out to. You know, a lot of our like residencies and the different provider heavy clinics are a lot more interested in like the long COVID presentation, kind of about where we're at right now. But we do try to get to like all the presentations to all the clinics. So a lot of times I'll reach out and, you know, just see if I could get a response, see if there's some interest in the presentations. And once they show interest, you know, schedule one presentation, and then I'll kind of offer up, you know, oh, you know, do you think we could have another, you know, hour of your time and come and provide lunch and do one of these other topics? So really, I try and get all the topics in all the clinics, but I guess it's really just kind of up to them to see what their staff would be most interested in. I know a lot of them will, the person who coordinates the education will bring it back to their providers and just kind of see, you know, which one do you guys feel you would benefit the most from right now? I hope that answers your question.
Yeah, it does. And then are you able to look at like clinic rates in a few different ways? I know that like Sanford does its own QI, and so it looks at provider rates, but it has different like metrics for how it measures that, how it like completes like a patient list. Like, do you use the what's it called now? IQIP rates, like do you run rate reports for clinics specific, or do you like look at regions, or how do you kind of measure improvement in that kind of focused way?
Yeah, we actually don't look at rates, mostly I believe because the project is centered a lot on COVID, and just with the pandemic, people were getting it not necessarily from their primary care provider, but from pharmacies, from all of these different, local public health units. So it was a little bit harder to track the COVID rates. But I guess we usually just try, when we get to a facility, we'll kind of test the waters, and ask, oh, how are you guys doing on vaccines? Do you do a lot of vaccines here? Not too many. But our evaluation is primarily reliant on kind of individual feedback through the evaluations and kind of overall just like acceptance of the presentations. But we don't have access to the clinic records for immunizations.
Okay, yeah, that makes sense. Thank you.
Great questions, Danny. Does anyone else have any questions about either Amelia's or Maeve's presentations?
Hi there. I have a couple questions, but I'm going to stay off camera because I have a 6-7-year-old at home.
Oh, no, of course. Thanks, Amanda.
Yeah, really fantastic and informative presentation from the both of you. So thank you so much. A couple of questions. So I guess the first one is for Amelia. So when looking at North Dakota and the rurality of the state and the lower immune rates across the state, one might assume that factors such as lack of access to transportation or lack of access to consistent and accurate information may be playing a role in decreased immunes. So given this, how is the state or CIRE informing places such as like local public health of the data that you guys are finding and encouraging best practice on what methods would work best to reach specific populations? Does this like involve potentially mobile vaccine clinics or school-based clinics, walking the block and knocking on doors, things like that?
Yeah, that's a good question. And I think since this is still kind of an ongoing project, because we still are potentially going to be doing some types of interviews or focus groups to see, why are these rates the way they are in certain areas of the state, and to potentially get a better idea of what would be some effective interventions and for improvement. So we haven't done anything of that nature yet. So we've shared kind of our summary report with individuals at the state, and they kind of will decide where to go and from there and whatnot. But so it'd be really interesting to get the full picture and a lot more of the qualitative data behind the quantitative that we have. But we are also doing a project on school-based vaccination clinics to look at, clinics that offer, or schools that offer them, schools that don't, what the rates look like, and some other questions. So I'm thinking that may help a little bit to look at how school-based vaccine clinics may impact that. So stay tuned. It's not done yet, and we're hoping that we'll be able to do a little bit more with the flu project too, to get a better idea of the states.
Thank you for that, Amelia. I don't mean to be taking up too much time, but I do have a question for Maeve. So I understand that your current role is to encourage an increase in vaccine rates, and that's the purpose of the current funding. But given that you have the ear of the physicians, the NPs, the PAs, RNs, etc., do you or does CIRE ever anticipate or see outreach into other disease processes that are impacting the health of North Dakotans, such as substance use disorders or behavioral health, mental health, sexual health, things like that? And that is a loaded question, Maeve, so if you don't have the answer, no worries.
I would say I myself don't have the answer to that. I guess our center is primarily focused on, the vaccines, as the Center for Immunization Research and Education. But I do think, as like the whole community, whole health, that is really important to connect with them. But I guess I don't have an answer. I see Dr. Carson's on screen here. Maybe he has an answer.
Yeah, thanks, Amanda. So, as Maeve said, the center is Center for Immunization Research and Education. So we don't have a mission beyond that, and the grant funding that comes in is usually very specific for various immunization-related research and education issues. Those things you're talking about are very, very important. Don't fall directly under that rubric. Could fall under like individual faculty members' interests, including my own, but some of the things you're talking about, for example, opioid use and addiction issues, we have several other faculty members that are very interested in that and pursue funding from the health department and other sources to do that kind of work. So, for example, Dr. Strand and the CAP Center in the Department of Pharmacy Practice are very involved in those things. And are looking and are also very interested in other chronic diseases, but it's not specifically the focus area for CIRE. And you're not taking up too much time. You got great questions, so fire away if you have more. And anybody else?
Does anyone else have any questions for Amelia, Maeve, or we have a large representation from the center today? Well, I guess we can give you guys all back a few minutes of your day. So I just want to thank you all for attending. Oh, I see Danny had one thing in here. I would also say that since there are programs specific to that, it's another important factor that they be working with the branches that has the most visibility in that data. That's a great point, Danny. And I know there's a lot of interconnectivity and different partnerships between NDSU and our department and the state health department. And I know that's a really great partnership that we continue to really appreciate and continue to support. So that's a great point. But I guess back to it, I'd like to thank you all for attending today. Again, this event has been recorded and we will be posting it on the college's YouTube page. Before we leave today, I just really want to thank Maeve and Amelia for their really excellent presentation. I am also going to quickly introduce our next speaking event. So for the DPH seminar series, the next event will be held on January 23rd at noon. Our speakers will be Drs. Andrea Husa-Sossel and Heather Fuller. They will be presenting vaccination perceptions and behavior among older adults. This presentation will explore perceptions related to vaccination and barriers to vaccination acceptance among older North Dakotans. The findings highlight the need for targeted interventions to address vaccination barriers as well as trust issues related to immunization information sources, particularly in rural and lower vaccinated areas to increase vaccination rates among older adults. Thank you guys so much for joining us today, and I hope you all have a wonderful and happy holidays. So have a great rest of your day, and we appreciate your support of our department seminar series.